Hello everyone, welcome back to anatomy sessions. So today's topic is on midline structures of the neck and thyroid gland. And thyroid gland, we know it is a large endocrine gland and it is a ductless because it is an endocrine gland and located in front of the neck and sides of the trachea, and it produces, stores and releases thyroxine hormone, and this is the only hormone which depends on the extraneous raw material like iodine. And because it is an endocrine gland and it pours its secretions into the bloodstream, it is highly vascular structure and it secretes T3 and T4 thyroid hormones. So let us understand what are the midline structures. So the midline structures, the deep structures which are present in the neck from above downwards, are the hyoid bone. The unique feature of the hyoid bone is it is the only bone which does not articulate with any other bone to form a joint, and it just kept in position by the attachment of muscles which are called as suprahyoid and infrahyoid muscles. And hyoid bone in the midline, it has got the body. On each side above, the small projections are called as lesser cornu and the large projections are called as greater cornu of hyoid bone. And between the hyoid bone and thyroid cartilage, we can see a white membrane which is called thyrohyoid membrane. Thyrohyoid membrane is pierced by superior laryngeal vessels and internal laryngeal nerve. Superior laryngeal vessels will supply the larynx, and internal laryngeal nerve is a sensory nerve which supplies the internal part of the larynx up till the vocal cords. And in midline we can see the shield like cartilage which is the thyroid. Thyroid means shield like. So this is the thyroid cartilage, and below the thyroid cartilage the ring like cartilage is the cricoid cartilage, and between the thyroid and cricoid, the white color structure here is the cricothyroid membrane, and below that we can see the butterfly shaped thyroid gland, and sometimes it may have an accessory lobe above the connection which is called as the pyramidal lobe of thyroid. So it has got two lateral lobes which are roughly pyramidal in shape, having apex towards upwards and base towards downwards, and both the lobes are connected by means of isthmus. The length is approximately 5 centimeters and breadth is 3 centimeters and thickness is 2 centimeters. So that is all about the dimensions of thyroid gland. And these midline structures, they are arranged in three layers: endocrine layer, respiratory layer and alimentary layer. Endocrine layer is the outermost layer which contains the thyroid gland and parathyroid glands. And respiratory layer contains the trachea. Here we can see that is the pharynx, nasopharynx, larynx and trachea forms the respiratory layer, and the innermost is the alimentary layer which forms the part of alimentary tract, that is the pharynx and esophagus. Pharynx and esophagus forms the alimentary layer. So this is how the cervical viscera are arranged in three layers. Extension of the thyroid gland, it extends from C5 to T1, similar to the root value of brachial plexus. The brachial plexus root value is from C5 to T1. The thyroid gland also extends from C5 to T1. And we know the isthmus connects the two lobes of thyroid, and there may be inconstant lobe which is above the isthmus which is called as pyramidal lobe, and often seen this pyramidal lobe connects to the hyoid bone by means of a fibrous musculofibrous connective tissue which is called as levator glandulae thyroidae, which is considered as the remnant of thyroglossal duct. Thyroglossal duct from which the thyroid gland develops. So this is the remnant of thyroglossal duct. In adults it may remain as fibrous tissue and some muscle tissue which is called levator glandulae thyroidae. It may or may not be present in all the individuals. Next, about the coverings of the thyroid, it has got the outer false capsule, inner true capsule. This red one is the false capsule. The green lining which is along with the gland is the true capsule. True capsule is derived from the connective tissue of the gland itself. Whereas the false capsule is derived from the pretracheal fascia and which is attached to the hyoid bone above and thyroid cartilage in its sides and blends with the fibrous pericardium below. So it is derived from the pretracheal fascia. Above it connects to the thyroid cartilage and the hyoid bone, attached to the hyoid bone also as levator glandulae thyroidae, and it is below it blends with the pericardium, fibrous pericardium of the heart. It is thin on the posterior aspect. So that is the reason if there is any tumor in the thyroid gland, it spreads posteriorly because the thyroid gland that is the false capsule is deficient on the posterior aspect. And one more important thing is about the venous plexus. The venous plexus lie deep to the true capsule. You can see these blue things. You can see here. These are the venous plexus which are shown deep to the true capsule. Whereas unlike prostate, the prostate gland, the venous plexus are located between the true and false capsule. So during thyroidectomy, while removing the thyroid gland, the complete thyroid gland has to be removed along with its true capsule and false capsule. Whereas while removing the prostate, the true capsule and false capsule kept in intact so that it prevent the hemorrhage from these venous plexus in prostate. So the portion of the fascia, that is the false capsule, it is stretching between the cricoid. You can see here, this is the cricoid cartilage and here is the thyroid gland. Between the cricoid and the thyroid gland, the posterior surface, the ligament gets thickened to form the suspensory ligament of Berry. This is the suspensory ligament of Berry. So that is the reason while deglutition, while swallowing, we can see if there is any swelling in the thyroid gland, it moves up and down along with the movement of the larynx because it is attached to the cricoid cartilage by means of Berry ligament or suspensory ligament of Berry. So we know the thyroid gland is enclosed by the pretracheal fascia and part of the pretracheal fascia forms this suspensory ligament which connects the lobes of the thyroid to the cricoid cartilage and we can also see it is related till the thyroid cricoid cartilage. Here is the anterolateral view of the thyroid. We can see the apex extends till the oblique line of thyroid cartilage between the middle constrictor medially and sternothyroid laterally. So apex is related to two muscles, middle constrictor and sternothyroid muscles, and it extends till the oblique line of thyroid, and we can see the apex is related to superior thyroid artery. Along with it we can see this yellow color nerve, that is the external laryngeal nerve. It is related to superior thyroid artery, external laryngeal nerve. Base is extends till the fifth or the sixth rings of trachea. It extends till the fifth or sixth rings of trachea, related to the loop of inferior thyroid artery and recurrent laryngeal nerve. It is related to inferior thyroid artery and we can see this nerve, that is the recurrent laryngeal nerve. And let's see the anterolateral and posterolateral relations of the thyroid. So here is the cross section of the neck at the level of thyroid gland, where we can see anterolaterally it is related to the strap muscles which are from inside out, they are related to the sternothyroid. We can see the sternothyroid, sternohyoid and partly overlapped by omohyoid, and all these muscles further overlapped by sternocleidomastoid. So anterolaterally it is related to sternohyoid, sternothyroid, superior belly of omohyoid and sternocleidomastoid. Posterolaterally, it is related to the carotid sheath and its contents. The contents present within the carotid sheath are the common carotid artery. Then we can see the vagus nerve which is sandwiched between the two vessels, and laterally what we can see is the internal jugular vein. So common carotid, vagus nerve and internal jugular vein. And posterior to the carotid sheath, the nerve what you are seeing here is the sympathetic chain. And within the anterior wall of carotid sheath, it is related to ansa cervicalis. And medially, the thyroid is related to the two tubes, two muscles and two nerves. In previous slide, we have seen medially it is related to two tubes. So you can see these tubes, anteriorly the trachea and posteriorly the esophagus. And here the thyroid gland outline is shown, showing its medial relations. And it is also related to the pharynx and esophagus, and it is related to the inferior constrictor. Here is the inferior constrictor of the pharynx, and cricothyroid muscle. This is the cricothyroid muscle of larynx. And it is also related to external and recurrent laryngeal nerve. Above this is the external laryngeal nerve, and we can see this vertically running nerve between trachea and the esophagus is the recurrent laryngeal nerves. So two tubes, two muscles, two ligaments. Here is an image to understand the infrahyoid muscles again. So we can see the thyroid gland, it is overlapped by superior belly of omohyoid. This is the superior belly of omohyoid, and this one is the sternohyoid muscle. This is sternohyoid. Sternothyroid is deeper, which is attached to the thyroid cartilage. So these are the anterior relations. Here sternocleidomastoid is cut. We can see the cut ends of sternocleidomastoid exposing the strap muscles. And we can also appreciate internal jugular vein, which is posterolateral to the thyroid gland within the carotid sheath. Then next about the blood supply of thyroid gland. So we finished up till the external features of thyroid and blood supply, arterial and venous drainage. Arteries, the two principal arteries are the superior thyroid and inferior thyroid artery, which supply the thyroid gland. Superior thyroid artery is a direct branch of external carotid artery. We can see the superior thyroid artery. As it reaches the apex, it divides into anterior and posterior branches. Inferior thyroid artery, it is an indirect branch of subclavian artery. So subclavian artery gives rise to thyrocervical trunk from its first part. So thyro means thyroid gland, cervical means neck. So it is meant to supply the neck and the thyroid gland. So thyrocervical trunk gives off the inferior thyroid artery, which reaches the inferior, that is the base of the thyroid gland, and it divides to anastomose with the superior thyroid artery. So this is the normal blood supply. Sometimes there may be an extra artery which is called as thyroid ima artery or thyroid arteria ima. This is an inconstant artery. If it is present, it may be sometimes directly from the arch of aorta, and here in this image we can see it is branching from the right common carotid artery. It is branching from the brachiocephalic trunk or sometimes from the right common carotid artery. So usually from the brachiocephalic trunk or the arch of aorta, the thyroid artery ima may be arised to supply the isthmus of the thyroid gland. Venous drainage of the thyroid gland, superior thyroid vein, inferior thyroid vein and middle thyroid vein. These are the common veins. Superior thyroid vein drains into internal jugular. We can see in middle also drains into internal jugular vein, whereas the inferior thyroid vein drains into left brachiocephalic vein on the left side. On the right side, it also drains into left brachiocephalic vein. And sometimes there may be a fourth vein which is called as Koch's vein, which is also an inconstant vein. And if it is present, it may drain into internal jugular or it may drain into brachiocephalic trunk. Next about the parathyroid glands. Parathyroid glands are mainly for calcium metabolism. There are two superior, two inferior parathyroid glands located along the posterior border of the thyroid gland. And we can see the parathyroid glands also gains their blood supply from the same arteries. So this is the superior thyroid artery and inferior thyroid artery. And we can see medially the two glands are related to recurrent laryngeal nerves. Next, applied anatomy of thyroid gland. Enlargement of the thyroid is called as goiter. It can be enlarged in hyperthyroidism or hypothyroidism. And hyperthyroidism means increased secretions of thyroid gland, results in exophthalmos, protruded eyeballs, tachycardia, increased heart rate, tremors, and increased BMR, basal metabolic rate. Hypothyroidism is called as myxedema, and it is results in reduced, exactly opposite, reduced heart rate, that is called bradycardia, edema, swelling around the eyes, and edema of the feet and hands, and basal metabolic rate is reduced. And plunging goiter, malignancy are the other conditions which we are going to see now. So here we can see the enlargement of thyroid gland which moves during deglutition, during swallowing. So thyrotoxicosis means increased thyroid secretions. Hyperthyroidism is called as thyrotoxicosis, due to which the whole gland enlargement, or there may be a thyroid nodule. So thyroxine will be high levels because of nodular thyroid gland is observed. Symptoms of thyrotoxicosis: insomnia, sleeplessness, nightmares, tremors in the hand, nervousness, and in older age may lead to cardiac manifestations, tachycardia, arrhythmia, and sometimes may reach to heart failure if they are not controlled or treated properly. Thyroid paradox: decrease in weight although increase in appetite. So the person is abnormally thin because of thyroid paradox, because of increased BMR, basal metabolic rate, and increase sweating and sense of hotness in, even in the hot weather, like that, hotness in the weather. Polyuria, diarrhea, often urinating, then tiredness, fatigability. Osteoporosis, thyrotoxic goiter in exophthalmos. Next, about the thyroidectomy, removal of thyroid gland. It may be done in any cancerous conditions or abnormally having some benign tumors, and the things which should be taken by the surgeons during thyroidectomy. One thing we already discussed about the venous plexus, which are located deep to the true capsule. That's why the whole thyroid has to be removed along with the venous plexus to prevent hemorrhage. The next is the important vessels and nerves which are near the apex and the base. So superior thyroid artery is very closely related to internal laryngeal nerve away from the gland. As it reaches the gland, we can see the superior thyroid artery diverges. It moves away from the internal laryngeal nerve. So always the ligation of superior thyroid artery during thyroidectomy, it is done near the gland to prevent damage to internal laryngeal nerve. Next, about the inferior thyroid, we can see the inferior thyroid artery. It is very closely related to recurrent laryngeal nerve, almost near to the gland. And away from the gland, we can see the both structures are quite separate. So recurrent laryngeal nerve is far away, and inferior thyroid artery becomes closer to recurrent laryngeal nerve only near the gland. So always the ligation of inferior thyroid artery is done away from the gland, not near to the gland. So superior thyroid artery should be ligated near to the gland, and inferior thyroid artery should be ligated away from the gland to prevent the damage of internal laryngeal nerve and recurrent laryngeal nerves. Next, about the hypothyroidism. So that was about the hyperthyroidism and thyroidectomy. Reduced thyroid secretions results in hypothyroidism, which may also result in swelling of thyroid, that is the goiter. And these are the symptoms: weight gain, fatigue and weakness, slowed heart rate, elevated blood cholesterol level, muscle weakness, muscle aches, changes in the menstrual patterns, depression and impaired memory, constipation and enlarged thyroid gland, and joint pain and stiffness, dry skin, hoarseness of voice because of compression of thyroid gland. The larynx may get compressed resulting in hoarseness of voice, and cold sensitivity. There we saw it is hot sensitivity, here they are cold sensitivity. So these are the symptoms of hypothyroidism. And next about the parathyroid, reduced secretions of parathyroid results in tetany. And tetany is a symptom that involves the involuntary contraction of the skeletal muscles. And we can see here in this man, we can see abnormally contracted skeletal muscles because of the stimulation of peripheral nerve. It occurs mainly because of reduced calcium levels in the blood, low blood calcium levels because of reduced parathormone, that is parathyroid secretions, resulting in a condition called tetany.